Welcome everyone to this would be our second health education webinar with BPOU. We actually are joined by one of our fellow executive board leaders, and that is Dr. Afaf Osman, hematologist oncologist, focusing primarily in the research and treatment of hematologic malignancies. She is faculty at the Huntsman Cancer Institute and and has been with us about going on 4 years now.
I think so, yeah,
Yeah, so I want to welcome her,
for sure.
and her and Victoria are co-leading. Victoria is a second year at Noorda College of Osteopathic Medicine, hailing from the great city of Provo. Uh, and so I'm sure we'll be joined by fellow Norder compatriots. So without further ado, I will turn it over to you, Dr. Osman and Victoria. For people, as we get to our quizzes, just to let you know, when you get to the section, please, and then we go over the answer, or excuse me, go over the question, and then the answers are kind of come up to select. Just put your answer into the chat, and then we will tell you whoever's first, or if Dr. Osmond is deciding on who won that particular question, and then we will ask for your email, and then within a few days, you'll receive your Amazon gift card. So, without further ado, I will go off camera, and I'll turn it over to you, ladies.
Okay, so hello everyone. Today we're going to be talking about colorectal cancer and why it's important, and then also important steps to take for prevention. So first, we need to understand what our colon and rectum are. So our colon and rectum are parts of the large intestine that help with the digestion process. So our colon, it makes up the majority of our large intestine, as you can see here, and it helps to absorb water and electrolytes from digested food. And then our rectum, it's towards the end of our large intestines, and it helps to store the stool that's remaining from that process before it leaves the body. So our colon, it's made up of several layers that help to support digestion and our movement of stool. And right here, I have a cross section so you can see all the different layers. So in colorectal cancer, it usually develops in the innermost layer, and that's due to abnormal cell growth that forms into polyps that are able to develop into cancer over time. So cancer is described as uncontrolled cell growth. So our body, it's made up of cells, and normally they grow, they divide, and then they die and are replaced with new ones. But with cancer, there are certain genetic mutations that disrupt this process and allow abnormal cell growth. And when this happens for a long period of time or at a rapid pace, these cells are able to spread to other parts of the body, which is called metastasis, and it's able to affect other organs and other organ systems, which isn't good. So in colorectal cancer, it starts in either it's the abnormal uncontrolled cell growth that starts in either our colon and our rectum, and they're usually grouped together since they have a lot of similarities. And most colorectal cancers begin as non-cancerous polyps, non-cancerous growths called polyps. And these are just abnormal cells that develop over time that can form into cancer. So right here, you can see our normal colon. And then as these abnormal cells begin to grow, they're able to invade surrounding tissues and lead to different problems in the body. Okay, so we have our first question, and it is, what are abnormal growths in the colon that can sometimes develop into cancer called? Okay, let me open the chat. Okay, yes, so the correct answer is polyps.
Well, I guess the first person who answered gets the prize, right? That's
Yes.
been,
So,
I think it's Afua.
okay, yes. Congratulations, Afia. Okay. So now that we know that polyps are the abnormal growths that develop into cancer in our colon, it's important to know that there's different types of polyps and that some carry a higher risk of becoming cancerous. So our first type is called adenomatous polyps, also called adenomas, and they're the most common, and they're considered precancerous because they have the potential to transform into colorectal cancer over time. And you can see how it'll look at different stages right here. And then we also have hyperplastic polyps, and they're usually small and generally considered to have little to no malignant potential. And then we have our serrated polyps right here, and they're usually larger and can become cancerous over time depending on their size and location. And so the polyps can develop into cancer, which is why it's important to make sure that you're doing routine screening procedures like colonoscopies to make sure that you're able to detect them and remove it before it's able to progress further. Okay. So when we look at colorectal cancer in numbers, it's one of the most common cancers worldwide, following breast, prostate, and lung. And in the United States, we have about 150,000 new cases every year. And it's also one of the leading causes of cancer deaths, of cancer-related deaths that's preventable. And typically it's seen in older adults, but it has been declining due to the increased rates of screening. However, the number of cases in younger adults below the age of 50 years old has increased, which has caused updated screening guidelines to make sure that we're able to catch it earlier. So the American Cancer Society estimates the new number of cases of colorectal cancer last year were about 109,000 for colon cancer, and they're about equal in men and women, and then about 50,000 for rectal cancer, and that was a little higher in men. And then there's also been about a 1.5% decrease each year for the mortality rate in colorectal cancer, which is just how like the prevalence of how many people have been dying in older adults, and that's likely due to the increased rates of screening. So there are several factors that can increase the risk of developing colorectal cancer, and there are some factors that can't be changed. However, there are factors that are related to lifestyle and environmental exposures that can be changed. So things that we can change are things like excessive alcohol consumption and smoking, obesity and physical inactivity, and also diets that are high in processed foods or red meats, and also a low fiber intake. But things that we can't change are increasing age, family history of colorectal cancer, or certain other inherited genetic traits such as Lynch syndrome, and then also chronic inflammatory conditions of the colon, such as Crohn's disease. Those are things that we can't change. However, if you do the things that you can change, it'll help to decrease your risk of colorectal cancer. And this is important, especially for us, because colorectal cancer is usually more seen in Black Americans are usually more affected by colorectal cancer. So we're 20% more likely to be diagnosed with it and 40% more likely to die from the disease. So this is why it's important to get screened because we're typically diagnosed at younger ages and at more advanced stages. So this leads to lower survival rates compared to other races. And contributing factors to this would include the lack of access to healthcare, lower screening rates, and also socioeconomic and structural inequities. So to solve this, it's important that we increase awareness about the disease. So that will help to improve screening access and also compliance once people know that it's important to be checked for it. And then also addressing systemic healthcare disparities. In addition to that, there have been studies done that shown that an increase in ultra processed foods have had a link to colorectal cancer in Black women. So high intake of ultra processed foods has like things like packaged snacks, sugary drinks, and processed meats, which would be things like lunch meat or like cold cuts, things like that and also
Mhm.
ready-to-eat meals have shown an increased link to colorectal cancer due to like all the additives and preservatives, which is why it's important to reduce those type of foods in our diet, and because that could help to lower our risk. And then family history is also an important factor in this disease because having an immediate family member, so someone like a parent or a sibling or child, it increases your personal risk of also having it. And the risk is also higher if the family member that was diagnosed with it before the age of 50. So that's so individuals who have a family history of it, they should speak to their doctor so that they can discuss maybe starting screening a little bit earlier, or if there are any other preventative measures they have to do to decrease the risk. And then because of the increased risk, people with family history, yeah, they need to screen earlier and also more frequently too.
Mhm.
So the screening age is important because colorectal cancer, it develops over time. It doesn't just happen immediately. So screening helps to detect polyps before they turn into cancer. So typically the screening age is, or the recommended screening age is 45 years old. But if you know that you have a higher risk for the disease, you may want to start screening earlier depending on the specific risk factors you have. And some of the factors that can make someone at a higher risk would be having a family history of colorectal cancer, having certain genetic conditions that make them more likely to get it, and then having inflammatory diseases such as inflammatory bowel disease or Crohn's disease that would
Yeah.
also increase the likeliness of getting colorectal cancer. And this is why early detection is very important because it can significantly improve survival and treatment outcomes. So the screening is also important because the earlier you catch it, the better chance you have of survival and treatment. And so these are just some notable people who have had colorectal cancer. So Chadwick Boseman, most people know him from Black Panther. So he was diagnosed in 2016 with stage 3 colorectal cancer that progressed to stage 4, and then he ended up dying at 43. And we don't know like the details of his situation, but as I already stated before, the recommended screening age is 45. So if he got it before that age, this just shows why it's important to get screened earlier if you have a higher risk of the disease. And also recently, James Vanderbeek is someone who just passed away from the disease. And as you see, he's 48, which is just a little over the recommended screening age. And it just shows why like screening early is important. And then over here, we have two people who have had the disease, but due to screening and taking and due to screening and being able to treat earlier, they have had better outcomes. So Sharon Osbourne, she was diagnosed with stage 3, which is a more progressive state of the disease, at 49. But she was able to get treatment for it, and then it hasn't came back since. And then also another notable person is Morgan Freeman. So he was diagnosed with stage 1 colon cancer at age 73, And since it wasn't as progressive, he was able to treat it with just a surgery, and it didn't have any effects to any other part of his body. So this is why screening early is important. Okay, so now we have another question. So, what type of food has been linked to an increased risk of colorectal cancer when consumed frequently? Okay, I'm not sure who got it first.
Diana, looks like, right?
Okay, yes. So, ultra
I mean, it's
processed.
all very close, but what I see on the screen is Diana.
Okay. So, a high consumption of ultra processed foods has been
Oh,
linked
yeah, I'm
to.
sorry. It's not Diana, it's Miriam. Yeah, it's Miriam. I
Right.
apologize.
So, Miriam, make sure you add in your email. The other thing to please be aware of, you only get to win once. So, for you med students on here, and in case there's any attendings, I repeat, you cannot just get all of the gift cards. All right. So, we're monitoring that. Even if you think you're quick on it, we're going to go with the first answer, and it's only for a new winner. Okay. Can't have multiple winners for the same question. All right. I will step off camera now. Great work, everyone.
Okay, so a high consumption of ultra processed foods has been linked to an increased risk of colorectal cancer. So B was the correct answer. Okay. So some common misconceptions about colorectal cancer is that only older adults can get it, which is not true. The number of cases in older adults has actually been decreasing, but the number of cases in younger adults has been increasing. And no one really knows why. Um, some people think that it may be due to like diet or like lack of physical activity, but there's no clear explanation. And then a fact is that colorectal cancer can be prevented. So, colorectal cancer is one of the most highly preventable cancers, and screening can detect and remove precancerous polyps. So, that's why screening is very important. And then, routine screening also reduces both the number of diagnosed cases and related deaths. Because if you're able to catch any polyps before it develops into cancer, you're able to just get rid of it before the condition worsens. So that's why screening is very important. And it's also important to recognize signs and symptoms so you know what to look for in case you think you might have it. So, since colorectal cancer develops over time, you won't get symptoms right away. It'll take a while before it shows up. But some of the most common symptoms to look for are blood in the stool, abdominal discomfort, unexplained weight loss, and fatigue. And the fatigue can also coincide with the blood in the stool because if you're losing a lot of blood, that's not good because our blood carries our oxygen and nutrients that our body needs. So if you're not getting that, your body's not going to feel good. So it's important that if you start to experience any of these symptoms, that you consult your doctor immediately so that you can get screened. And if there is something going wrong, even if it's not colorectal cancer, you can still treat it before it worsens. And there are many different types of screening tests. So the main ones would be the colonoscopy and a fecal immunochemical test. So the colonoscopy is considered the gold standard for colorectal cancer screening because it's able to directly visualize the colon, and doctors are also able to remove any polyps that are detected during the procedure. And then the fecal immunochemical test, it's able to detect any hidden blood in the stool and also any abnormal DNA from cancer cells. And it's also non-invasive and done at home, which is nice. And then there are many other tests that are also used to detect colorectal cancer, but they're just not as preferred. So the colonoscopy is a gold standard for screening, and what this procedure entails, it's just a flexible tube with a camera on the end. It's inserted through the rectum, and then it's moved throughout the whole colon to examine it. And it's good because it's able to identify any abnormal growths, any polyps, or any tumors. And if there are polyps found, they're able to be removed during the procedure, so that can help prevent colorectal cancer. And for the colonoscopy, the recommended screening age it's to begin at 45 years old and then repeated every 10 years if everything is normal. But for higher risk individuals, you may have to start screening earlier and also more frequently.
Victoria, I'm just going to answer a question here because I don't want it to get missed in the chat.
Okay,
I think someone is asking about blood in the stool and hemorrhoids. Oh, people are already answering the.
I'm sorry.
Okay, you can go ahead, and then I'll
Uh,
answer the question after.
Okay. So, okay, I can't see the chat, but which of the following can be a warning sign of colorectal cancer? So we have blood in the stool, persistent changes in bowel habits, and unexplained weight loss. So the answer would be D, all of the above. So whoever got it right first, congratulations. Okay, I'll go back so you can answer the question.
Yeah, I think it's Donald, right? But I was going to answer this question about the blood in the stool. It's true that one of the most common causes for having blood in the stool is hemorrhoids, and hemorrhoids are more common than colorectal cancer. But I still think it's a symptom that you want to talk to your doctor about and make sure that your doctor is aware, and they can examine you and take a more complete history. There are other signs that worry us if they are present, like fatigue, weight loss, dizziness, lightheadedness, iron deficiency anemia, because as people lose the blood, they lose iron as well, and oftentimes they become iron deficient and then maybe even anemic, especially in men. Iron deficiency anemia in men is something that should be looked into to make sure that the patient has had their screening done. But yes, it is. It's hemorrhoids are common and common things are common, but I think it's a symptom that you should not ignore and have your doctor look into it and just make sure that everything is okay.
Dr. Osman, I have a question.
Yeah.
So, if someone's at average risk, would you encourage them just because sometimes we live in a state where the ratio of GI doctors to that of people actually needing colonoscopy screening isn't the best ratio? Do you encourage people to maybe do the FIT test more in case they can't get in for the gold standard of a colonoscopy?
Yes, yeah, the fit test is one of the preferred tests, and can do it at home, and you send it in, and it's basically looking for specific mutations, changes in the DNA that we know are associated with cancer. If the fit test is positive, most of the time people will have to do a colonoscopy anyway. But if it's negative, then it has a good predictive value for ruling it out. And I believe it's more often than the colonoscopy in terms of like the colonoscopy is only every 10 years. So both of them have kind of pluses and minuses. But I think, yes, as you said, colonoscopy at the end of the day is a procedure and it's invasive. So the fit test is a nice alternative for people who may not be able to access gastroenterologists or have higher risk, in terms of a procedural risk. So,
Should the FIT test be every year if you get access to it?
no, I don't think so. I mean, I think it's actually less frequent than that, but it's not is more frequent than the colonoscopy. So it's about every 2 years,
Yep. One to
every two
two.
to 3 years. Yeah, yeah. So, um, yeah, 1 to 2 years actually. Mhm. The
All right.
colonoscopy is every 10 years if it's normal. Again,
Mhm.
this is saying if things are normal, right? Because sometimes a colonoscopy will find some polyps and they ask patients to come back and do it, in 3 years or in 5 years. So again, it's
Mhm.
individualized.
Understood. I also was going to point out if anyone has Select Health or University Utah health plans in our state, on all their health plans on both their websites, you can actually order a fit test to be delivered to your home. That's part of your benefit with both with your if you have Select Health or
Oh,
University
nice. I didn't
Utah.
know that.
Yep.
Very cool.
Okay. So, when we talk about colorectal cancer, since it progresses slowly over time and there are different stages of it, and the staging just describes like how far the tumor has spread, and then it's used to guide treatment decisions and also the prognosis. It was just like how, I don't say bad, but like how bad it is. So for colorectal cancer, it starts off from stage 0 all the way up to stage 4. So with stage 0, it's also known as carcinoma in situ, and that's just abnormal cells that are found in the innermost colon lining. So remember the colon is comprised of different layers. So with stage 0, it'll just be like abnormal cells just like on the inside. So the cancer hasn't invaded into deeper tissues, and this is what's often discovered during routine screening. And it's usually just treated by removing the polyp containing the abnormal cells. With stage 1, the tumor has grown beyond the inner lining, deeper into the different colon layers, but it hasn't spread to any nearby lymph nodes or any other distant organs. And this is usually treated by just doing a surgery to remove the affected segment of the colon. And the prognosis is usually very good when detected at this stage since it's still early on. So you can see like what this would look like right here. It just affects a part of the colon, but it hasn't spread to anywhere else yet. So in stage 2, the tumor has grown through the different colon layers, and it also may reach nearby tissues, but it hasn't spread into the lymph nodes yet. And so treatment for this would still be just surgically removing the tumor. But at this stage, some patients may have to receive chemotherapy based on risk factors that they may have. And you can see how in stage 2, it spread more and it's a lot wider also. So in stage 3, the tumor has spread to lymph nodes and it can spread to nearby tissues at this point. So it will still be treated with therapy. It will still be treated with surgery, but then it's also usually followed by chemotherapy to reduce the risk of reoccurrence. And then you can see how it's now larger and then it's also spread to different parts of the body, and which is called metastasis, like we learned before. And then in stage 4, the cancer is now spread to distant organs. So it can spread to like your liver or your lungs, and it'll start to affect those organs and those organ systems. And then it can also spread to our lymph nodes and also other nearby tissues. And treatment for this would be surgery, chemotherapy, targeted therapy, immunotherapy. It will just depend on the person and the state that they're in. And at this stage, it's usually a lot more complicated and more serious compared to the other stages, which is why it's important to get screened earlier so that it doesn't develop to this stage. So these are the different treatment options that are primarily used for colorectal cancer. So we have surgery, chemotherapy, radiation therapy, immunotherapy, and targeted therapy. And the the treatment of choice will usually just depend on the type of tumor that the person has, and then also risk factors that will be discussed with your doctor, because no one treatment is going to work for everybody.
Mm.
So that's why you'll have your individualized plan for whatever works for you. Okay. So now that we know what colorectal cancer is, it's important to know how to prevent it. So some of the big things we can do for prevention is to maintain a healthy body weight and stay physically active. we can eat a diet that's rich in fruit, vegetables, and fiber, and also limit processed foods and red meats, and also avoiding tobacco and consuming alcohol in moderation. But one of the most important things we can do for prevention is routine screening because it's most effective and it can detect and remove precancerous polyps. So this is the one of the main things we can do. Okay, so now we have another question. So why is colorectal cancer screening so important? Is it A, because it detects cancer early, B, because it can identify and remove precancerous polyps, C, because it helps reduce mortality, which is just the number of deaths, or D, all of the above?
Wow, people are really fast. I'm impressed. I guess the right answer
Yes, so the right answer is D, all of the
and
above.
above. Yes, Emily is the person who. I think there was a question about polyps. I think your question is, what did you want to know about polyps? Polyps in general are just an abnormal growth in the colon. I think Victoria has a
I
slide
wanted
on
to ask,
that,
I
like
wanted to ask a question of
in the
if you have polyps, how often should you have a colonoscopy?
so that's a
What is that?
going the polyps because there are polyps that are I think Victoria that the adenomatous polyps are usually considered, but then adenomatous polyps. So it really depends on what the if it's a more higher 3 years, if it's a lower risk polyp, it could be after they do the pathology lab. And in the pathology lab, the pathologist will look at it under the microscope and they will tell them whether they see any abnormal looking cells. And so neurologist who did the colonoscopy usually will call you and let you know how often your screening should be, if it's in 3 years or 5 years or 10 years.
Thank you.
Did everybody hear that okay? I think you broke up a little bit there, Dr. Osman. Or
Oh,
did everybody hear her okay?
Bits and pieces.
I
Okay, so I think,
apologize. Is it my internet?
yeah.
Oh no.
Yeah, I don't know if it's, I don't know, maybe sometimes when it gets like that, you might have to increase bandwidth but we can hear you fine now. But to summarize your statement, it's based on pathology grading of the polyp to determine intervals of how often to be screened. So it can often be as frequent as 3 to 5 years. So if you had mild, no, and polyps, and based on sort of the number and your other risk factors, it
Exactly.
can be as short as five. It can be probably as short as 2 to 3 years, but more common
Yes.
as every five.
Yes. So the doctor who does the colonoscopy, they're called a gastroenterologist. They will usually call you after your procedure to tell you what the polyp is under the microscope. Because when they take the polyp out, they send it to pathology, they look at it under a microscope, and then they call the patient back and they should tell you, hey, you will need to be screened every 3 years or you need to be screened every 5 years. And if you don't get a call like that, you should follow up and ask, what actually, what did it show under a microscope and how often should I be screened based on what the polyp is and how many there were.
Great. That answers my question.
That's a great question, though. Thank you for asking.
Okay, let me find where we were. Oops. Okay, so D was the correct answer for this question. Colorectal cancer screening is important because It can detect cancer early. It can identify and remove precancerous polyps, and it also reduces the number of deaths from the disease. Okay. So, colorectal cancer is a serious disease, but it's also highly preventable with proper measures. So, regular screening starting at age 45 can help to remove polyps before cancer develops, and this will also save lives.
Can I just
And then
add
some of
something here? Sorry, Victoria. Age 45 is for the general population, so people who don't have, family history, who don't have certain diseases like ulcerative colitis or Crohn's disease. But people who have risk factors may need to screen before age 45. So I would say the age of screening is something that should be discussed with your physician as well because it is personalized to an extent. And then the other thing is we are seeing, like Victoria has mentioned, a rise in colorectal cancer in people in young people, and like you've seen with these celebrities, they were diagnosed in their early 40s in some cases. So even if you're below age 45 and you have symptoms, then you should really still check with your physician because we are seeing a rise in young cases as well.
I was
Keep
also
going.
going to mention that this is an opportunity as well as leaders, often in your community, and being an advocate for, Black and marginalized groups. What is not helping sometimes that some of the celebrities, and I don't know if some people have understood that with some of the fine print that might be going under when we hear about a James Van Der Beek or someone that might have passed from colorectal cancer or even breast cancer. What they don't mention sometimes is many of these celebrities who have high incomes, great access to care, traditional treatments, uh, sometimes they will defer and they will be influenced by non-standard
Oh, yeah,
alternative treatments,
that's a huge problem.
which
Yeah.
unfortunately, and that's something that James Van Der Beek actually had done. So that's why sometimes you're like, wow, why is someone of this age succumbing to it? But then you come find out for his last year of state, when he went from stage 3 to stage 4, he was using holistic, non-chemotherapeutic or even radiation to address his cancer. And that's being done, unfortunately, with some of the celebrities are influenced and others that are prominent by non-traditional medicine, which Dr. Osman, please speak to how you, because maybe have even seen this in your own practice.
Yeah, I mean, all of us unfortunately see this. I think, non-traditional medicine, can be done as kind of a supplement or a complementary to traditional methods, but it should really not be the only thing that you are or a cancer patient is using. We have a lot of therapies lately, and the outcomes in general have improved for colorectal cancer. So if you go back to that slide that Victoria you had in terms of the different therapeutics that we have, some of these new therapies are very promising. Things like immunotherapy. No, it's a slide later. So immunotherapy, targeted therapies, surgery, chemotherapy. So these are available for people even at stage 4 disease, So I think, even if someone's diagnosed at stage 4, we still have all of these therapies available to them, and they may be able to live years after their stage 4 diagnosis. So I really encourage people to see a board certified oncologist at a reputable cancer center. And a lot of cancer centers nowadays support people in terms of like nutrition, in terms of like, at the Huntsman where I work, we have an entire wellness center that has things like acupuncture. They have a massage therapist, a nutritionist, an exercise physiologist. So I think we're integrating a lot of these into our practices, but it should really be done. The treatment should really be done with a board certified oncologist. And if you're interested in these complementary therapists, you should talk to your oncologist about it. And you may be surprised that they are able to help guide you in that as well.
And just to reaffirm that even more, as someone that is on the paying side, approving chemotherapy, there are patients that I'm still approving for stage 4 treatment of colorectal cancer since I began working for the U in 2021. So that's 5 years now, and they are still being treated, and it's kind of keeping it in check. So it is, you know, treatments have improved substantially from 10 years ago,
Yes.
or when you might have had a relative back in the early 2000s that might have succumbed to colorectal cancer. Okay,
And
I will be
yeah, and the
quiet now.
toxicities have decreased as well. I think that's another thing.
Hmm.
'Cause when people hear chemotherapy, they may be again remembering someone in their family who had chemo 10, 20 years ago when chemo used to be super toxic, right?
Yeah.
But a lot of these newer therapies, immunotherapy, target therapies, they don't have as many side effects. In chemotherapy itself, we have figured out how to reduce a lot of these side effects. We have very strong medicines to prevent these side effects. Okay. I think someone says, do you have a database of Black doctors in Utah that we can go to for colon cancer support? It's a great question. I don't think there are a lot of oncologists who are Black in Utah, unfortunately. Richard, do you know? I mean, at
I mean,
Huntsman.
you're one of them,
Yeah,
technically.
I treat leukemia, but yeah,
I know.
I can help refer to some of my colleagues.
Yeah. We
Yeah.
have one black GI doc. That's
Okay.
often where you'll start with screening,
Okay.
but we do have allies that Dr. Osman can probably recommend, her peers, that she would probably be fine treating one of her family members or herself if succumbing to colorectal cancer. But as
Yeah.
for black physicians, that's part of what we're trying to do at BPOU is try to increase exposure and direct more of our Black pre-meds, med students to possibly go into these fields. But we do have a healthcare
Yeah.
provider directory.
Yes.
That's if you go to bpou.org. Mind you, we do need to update it a bit, but it's the blue tab in your top right. And
Yes.
sorry, Victoria, that we have been just talking all over your lovely presentation here. Sorry, Dr.
Oh,
Osmond.
it's okay.
I just don't want to like miss mortality really dropped. Yes, mortality for all cancer in general has dropped, and I think there was a recent statistic that was published that about 75% of patients with diagnosed with cancer in the United States should live at least for 5 years. So that was kind of a good milestone in general for all cancers. So yes, we have made improvements in cancer treatment. So again, that's why I go to an oncologist. Don't depend on these alternative therapies. Okay, Victoria, sorry. Keep going.
So, included with prevention, we also need to maintain a healthy lifestyle. And this can be done through diet, increasing our physical activity, and also just being aware of risk factors that you may have. And all that combined can help to reduce the risk of developing colorectal cancer. And then as Black people, it's important that we make sure that we're doing this because the deaths are higher for us. So that's why we have to make sure that we're staying on top of this. And the best way to do it is to make sure you're getting regular screenings. So if you begin to experience any of the symptoms, so like blood in the stool or changes in bowel habits, it's important that you discuss it with your doctor so that if this is the case, you can catch it early and then you can also treat early before it's able to develop further.
Again,
So if
I want to
any
add, sorry, I just want to add that, yeah, in Black people, cancers develop at a younger age as well. So again, that 45 years old is for the general population. But we know that Black people have cancers that are at a younger age and they're more aggressive too, meaning that when they're discovered, they're usually at a later stage. And then, like Victoria said, they're higher deaths. So for the same stage of the cancer, unfortunately, Black people have a higher death rates than other ethnicities. So again, this is important to keep in mind.
So if anyone has any questions, you can ask it now. And then I'm also going to put a link to this presentation in the chat for if you want to look at it later. So
So
yeah.
For all our
Very
presentations, just so everyone is aware, these will be placed on YouTube in a few days. So if you want to look at our past ones, it'll be in our community webinar. If you go to actually, it's probably easier if I just show you on our tab. But if you just go to bpou.org, and this is where we try to put up all our recent ones, and I'll share the screen here in just 1 second so everybody can see it. It will be, where is it at? Here we go. So if you go to our screen and let me move this around, you see where it says resources, it says community presentations. This is where the presentation will go, and it will also be by on our YouTube channel. Okay, so just remember it'll be in those two areas. Sorry. And questions. Anyone have questions? Feel free to come on audio or put them in the chat.
think a lot of people ask questions along the way. Hopefully, I didn't miss any from the chat.
Yeah, this is impacting a lot of us, and there's more and more information coming out regularly that was not there even 5 years ago on incidence rates, and particularly the higher correlation of our diets. Not to say we are eating ourselves into cancer, but given that what ultra processed foods, anything that's causing increased inflammatory changes in our gut, increases that cellular turnover, which increases the opportunity for a mistake to occur. Would you agree, Dr. Osman?
Yeah. Yeah, and I do want to say that ultra-processed foods have been linked to other health issues, including obesity and metabolic syndrome, things like that. So decreasing the intake of these will help with multiple other, health conditions, I think. So I think it's important to decrease those. And the same thing goes for other sort of preventative things like exercise. Exercise reduces the risk of multiple other cancers, including, breast cancer, um, you know, uh, things like heart attacks, high blood pressure, stroke. So I think these interventions, like lifestyle interventions, they're really underrated, right? So it's not just colorectal cancer that you're protecting yourself against. You're protecting yourself against multiple other things. So my question is, can it be hereditary? I think Victoria had mentioned that a little bit. Yes, it can be inherited. And as Victoria was saying, if you have a first degree relative with colorectal cancer, especially if they had it young, so before the age of 50, then you really need to talk to your doctor about doing a screening colonoscopy at a younger age. Usually they'll do it 10 years before the youngest case in the family. And there are well-known sort of inherited syndromes that include colorectal cancer. So things like something called Lynch syndrome, where people have a variety of other tumors as well. They can have endometrial cancer, colorectal cancer, among other tumors, things like Leigh things like a very famous one is adenomatous polyposis, which is when people have a lot of polyps at a very young age as well. So yes, it can be inherited. If you have a strong family history, please discuss with your physician because you can get screening at an earlier age. And you can also maybe do genetic testing to see if you have inherited any of these syndromes that may increase risk for other types of cancer as well. So yes, family history is very important. No, I'm not trying to scare you, but like Victoria said, this is a very preventable, really a colonoscopy is super easy. And if polyp, they just yank it out. And very little downtime. So this is not meant to scare people. This is meant to inspire people action, discuss factors and discuss their screening. And again, if you don't want to do a colonoscopy, there's also the FIT test. I hope that answers the question.
I do have one last
Yeah,
question.
the purpose is not fear, it's encouragement. Okay, go ahead. Sorry.
My question then, with all this information and we got to screen and get these tests, I've already kind of been on that track trying to, but I've actually faced a lot of barriers with like the system and like going through insurances or being rerouted or basically kind of the red tape of it all. And then I never even got to do the thing that I needed to do. So I didn't know if you had any inspiration or advice for those of us who have to like fight against the system to try to get these things taken care of, and it just ends up falling flat in the end.
Oh, yeah. I mean, that's the part, the hard part. I think you really have to be an advocate for yourself throughout this journey, right? And that might be one of the reasons that Black people have worse outcomes is because of these systemic hurdles that we have to face. Generally, insurance should cover screening for people who are above age 45. If you're below age 45, then family history will help you get that covered as well if there's strong family history, or if there's symptoms like blood in the stool or change in bowel habits, weight loss, things like that. Those are kind of like the indications. And I think Richard can tell us more about the insurance part of it as well. But I'm
Yeah,
sorry that you have to face that. It is really frustrating.
yeah, you bring up a good point, and there's actually a large initiative under the Utah One Health Collaborative that's going on at a state level to actually improve colorectal cancer screening, particularly this month. And even with university health plans and some others, we've realized that some people that go in for preventative screening, which is a covered benefit, but it sometimes becomes the diagnostic, which sometimes involves cost sharing, meaning you as the insurer have to sometimes pay extra because it is sometimes no longer being considered preventative, even though you went there for the purpose of prevention, no increased risk factors. They remove a polyp, and now you get a bill in the mail. But the thing is, that should be covered. So what I tell people to do through your customer service line or through care management at your insurance plan, to say, I am due, or I want to get my free fit test, or I am due for my colonoscopy. Please help me get on the wait list. Please help me to get scheduled. That is their job. From the customer service to a nurse care manager with your insurance company. That's what I would do. Because they want to help, because it actually improves the quality rating of an insurance plan, because this is a measured preventative cancer screening. So when it comes to things such as mammograms, colorectal cancer screening, cervical cancer screening, it looks better for the health plan that they're actually to reach more of their members to get them screened. So please let them know if they're missing you, and because you do not want to be a gap in care. I do this all the
Yeah.
time.
And I think the colonoscopies at the university are months out from what I know because I've had tried to get my patients in for these screening colonoscopies. But I think that's okay. I mean, like, just get on the list and they usually have a cancellation list, get on the cancellation list as well. And it's okay if it takes you a couple of months to get the colonoscopy. If it's a true screening, if someone is not having any symptoms, you know. If someone is
Yeah.
having symptoms, then it's not a screening colonoscopy anymore, right? So there's a difference too between those two.
And remember, there's if you haven't had one yet, there's still the fit test. If you're like not doing anything or hadn't had anything done in several years, and you're just waiting on the initial or maybe your second colonoscopy, you can still do the fit. And if that's positive, that actually will move you into diagnostic, and that will take you out of the screening range
The fit test
population.
is only for people who have standard risk. So,
Yes,
some of
average.
people have all these inherited conditions and people have, the inflammatory bowel disease, Crohn's and things. People have a more complicated history, then the fit test may not be the best test for them. And it's not a
Great,
test that's done for symptoms as well if someone's having blood in their stool, for example.
great questions. Any others?
Yeah.
And just to let everybody know, by the end of this week, those that are our winners, meaning those that answered first, will receive their Amazon gift card. And this will be up by the weekend on YouTube and put out in our next newsletter.
Awesome. Thank you, guys.
All right.
Congratulations. Yes.
Yes. Awesome. Well, thank you everyone for attending. We will close out now if Dr. Osman, Curabell, and Victoria can stay on for a minute. That'd be great.
Sure.
And look out for our next one. We are trying to do a possible mental health uh, webinar next month. We're just trying to narrow down our date. So if anything, you'll know by the beginning of the month. If you can, I put in the chat. We have, of course, our Brothers and Sisters, our BSTR event, Brothers and Sisters That Run has a swimming event next Sunday, and we have our spring awards and dinner. So hopefully it's open to the public to celebrate Black excellence in medicine. So we're going to celebrate our medical students, our pre-meds, and our docs. So if you can, get the early bird ticket. It's going to be a good time. I think we have Cafe Mamai that will be doing our catering, and we'll go through that. Kiribel, did you want to announce? It seems like we keep getting questions on announcing the winners.
Yeah, Afua, Mariam, Donald, and Emily.
Okay, excellent. Once again, the winners were decided by Dr. Osman and who answered first. There will be more opportunities in our next webinar. Thank you, everyone.